South Sudan's government vows to revive agricultural production after years of struggle due to civil war. University students are in solidarity with the nurses associations who are demanding for better pay from the Gambia government. And Uganda urges WFP to buy its local food products to feed refugees residing in the country. Well, these and more coming your way in News Desk. Hello, this is Africa TV and many thanks for joining us. I am Amadou Kante and now the news in detail. Now, the South Sudan's government says it is out to support local farmers to improve their farming activities after years of struggle, mainly due to years of civil war coupled with natural calamities. The country's agricultural ministry will request funding from the World Bank to provide farmers with farming tools to enhance their activities. The United Nations is urging the government to focus more in promoting agriculture to improve the living condition of millions of people displaced internally. Here's more details of that in this report.
Relentless rains last year led to flooding in most parts of South Sudan. Lots of livestock and crops were washed away. 6 years of civil conflict have also disrupted agriculture, and the United Nations says there has been an increase in cattle raiding which resulted in loss of more livestock. Now, South Sudan's government says it wants to support agriculture by providing farm inputs such as chemicals, seeds, fertilizer and equipment. The long years of civil war left many here injured and unable to carry out work that requires physical strength.
Some people actually are not able to access food, not because of their own fault. They may be disabled. They may be actually people who do not have the means to cultivate or to cultivate enough.
The Agriculture Ministry says it will seek the funds to provide the farm inputs from the World Bank. Most farmers in South Sudan practice subsistence farming where they use traditional farm tools, grow what is enough only to feed the family for a shorter duration of time, and they depend on natural factors such as rains. The United Nations says about 1.6 million South Sudanese people are internally displaced and depending on food aid. It is urging the government to do more in order to promote agriculture in the country.
We're asking for the government to support those areas by providing those communities with more land so that they can grow more food for themselves, whether they are refugees that South Sudan is kindly hosting in this country, or whether they are displaced South Sudanese who cannot yet go home to their own land.
The Ministry of Agriculture says it plans to distribute seeds, fertilizers and tractors to farmers. However, the UN warns that without durable peace across the country, no amount of equipment or materials given to farmers will resolve the country's food crisis.
South Sudanese government to provide farming tools to local farmers to boost farming production in the country after years of struggle due to civil war. Now, the number of children whose births are officially registered has increased significantly in the Gambia, but tens of thousands more remain unregistered. The 10 minus the global reality where 166 million children under 5 are homeless by documentation, according to UNICEF. Mariama Cham has more of that in this report.
Globally, 1 in 4 children under the age of 5 has no nationality anywhere in the world today due to lack of birth registration or proof of nationality. The United Nations Children Emergency Fund ascribed the reasons for this to the lack of resources and investments in accurate and comprehensive civil registration systems, coupled with barriers in accessing birth registration services along with policies, regulatory and institutional obstacles. The National Assembly of the Gambia recently amended the Bill on Birth, Marriage and Death, giving parents and guardians a 30-day birth registration deadline or be liable to a fine. Sama Balde, a child protection specialist at UNICEF, explains the importance of registering the birth of a child, noting that there is more to be done to prevent the situation of statelessness.
Birth registration provides the first legal recognition of the child and is the first right in the Convention for the Rights of Children. It enables a child to receive medical treatment, go to school, inherit property, and find legal work. It also facilitates protection from child labor, arrestation, treatment as adult in the justice system, forcible conscription in armed forces, child marriage, trafficking, and sexual exploitation. There is still a lot to do ensure that all children in the Gambia obtain their right to birth registration, and we are lagging behind in our objective to reach 100% of birth registration in 2030.
Lamin B. Fati, a registrar of births and deaths, says UNICEF's intervention led to the creation of outlets where people can get birth certificates without having to travel all the way to the main referral hospital in Banjul.
Because of this, the UNICEF program supporting the Ministry of Health to ensure that our decentralization and integration of birth registration processing into reproductive and child health services. That led to the creation of the Ministry of Health to create 73 registration centers and 252 outlets where registration can be held and certificate will be issued at the regional level instead of people traveling all the way from Bolibana to Banjul for a certificate.
The support from UNICEF includes desktop computers, server machines, laptops, tablets, and printers meant to facilitate the work of public health officials in registration of births and deaths in the country. Data from the Multiple Indicator Cluster Survey of 2018 shows a slow increase of 5.8% in the number of births registered from 2010 to 2018. While the figures look bad, 78 out of every 100 mothers and caregivers know how to register their children. Reporting for iAfrica News, I am Mariama Cham.
UNICEF, they are donating, of course, birth and death materials to the Gambia. And from that report there, up next we go to Uganda, because Ugandan authorities have urged the World Food Programme to purchase food products from local farmers to feed refugees in this African country. Officials of the UN Food Agency are, however, concerned about the quality of the food produced in Uganda. The humanitarian organization is also struggling financially to adequately respond to the refugees in need. Let's have more details of that in this report.
Mealtime at this refugee camp in Midwestern Uganda. The rush is for this maize meal and beans. It is what the refugees here eat daily. Most of it is imported. Now, Uganda is demanding that the UN World Food Programme buys food from its farmers to feed these refugees.
We are going to cause no procurement of food from outside Uganda by the World Food Programme. Let the money remain here. Our farmers there are a lot of food around here. Cereals are there.
The World Food Programme, however, says it purchased over 110 metric tons of locally produced food in 2020. But there are concerns over Uganda's capacity to meet food standards.
One of the issues to tackle there, Honourable Minister, is the issue of the poor quality of post-harvest handling. This is the only reason why, despite investing for several years, we have not been able to purchase locally in Uganda.
Last March, Kenya banned the importation of Uganda's maize flour over safety concerns. The food crisis is growing, with the World Food Programme struggling to provide food for the refugees. Last December, the food agency was forced to cut its rations by 40%.
When we do not have the needed resources to provide the food that refugees require to feed them on every single day, we are forced to apply ration cuts. The ration cuts are applied in a way that still allow us to provide sufficient energy and calories to keep and sustain lives. And this is the primary focus of that. So as we go forward, depending on the funding situation, you will see ration cuts going up and down.
The World Food Programme says it requires $221 million to end the cuts to more than 1.2 million refugees who rely on assistance to meet their daily food needs. The continuing growth of displaced populations in Uganda is driving an increase in the demand for food. And with limited supply, small-scale farming interventions that encourage the production of vegetables and staple foods are being promoted in the settlements, at least until when the UN Food Agency can fully restore the full rations.
And from the reporter in Kampala, Uganda, we will now take a break and come back shortly with the remainder of the story. Stay with us. We'll be right back.
The pride we take in our brand, the work we put into constantly change the landscape and elevate real estate in the Gambia, it's compared to none. From inception, our goal was to add value to the beautiful Gambian landscape. That's why we are proud innovators of community estates. Kololi Sands is an exceptional piece of work, tailored for ultimate convenience and luxury, to bring you an element of finesse that is rare but unique in its own. This is also our pride and joy, and we welcome you to the exquisite beauty right here in Kololi and right here on the waterfront. Kololi Sands, feel the ocean breeze at your doorstep.
Welcome back. This is Africa TV, and once again, thanks for joining us. Now, students of the University of the Gambia are noticeably in solidarity with nurses and midwives in their demand for better welfare. The Gambia Nurses and Midwives Association, in a press conference on Monday, threatened to go on a sit-down strike should the government fail to meet their demands in this week. Now, let's have more details of that with Binta Fati.
The healthcare workers called on government to deliver or face the consequences in the form of a nationwide sit-down strike. Their demands include the provision of personal protective equipment as well as an increase in their allowance, which they argued has been stagnant for decades. The decision of the association sparked debates among Gambians, including students of the University of the Gambia, most of who give merit to the demands of the healthcare workers.
And this is really heart-touching. It's heartbreaking. It's the same that the government of this country is not considering our nurses, because the most important sector that the government should prioritize is the health sector. We cannot talk about democracy or development or any other advancement without people being healthy. If our people are not healthy, we cannot do anything. We cannot go forward. So the nurses, what they are complaining, I really support it. Imagine gloves, mere gloves. Government officials are riding very expensive vehicles, but the gloves that the nurses need in the hospitals to take care of our people are not available. Injections, imagine a nurse using an injection on 2-3 people, putting many other people at risk.
For Kadi Kombaseidi, even though the decision of healthcare workers will cause potential havoc on the health sector, their demands are good for the public as it means better resources and logistics for patients.
To me, it's going to cause a lot of havoc on our health sector, even though, on my own opinion, it is a good thing for them to do, because I think they deserve better than what they are getting. They are not just demanding for allowances and salaries, but they are also demanding for better resources, better logistics in their health sectors, which are not available to them.
The Vice President of the UTG Students' Union, Famta Danso, said the primary duty of every nation should be to invest right in the health system, as it determines the success of a nation.
So if the first contact point, which is the health system, is in a dilapidated state, I think it should be a cause for concern, and it should be a national cause for concern. And then we hope that the authorities have had the claims that have been made by the health personnel and would also look into taking up actions that would curb the situation.
Alhaji Silla, the Vice President of the UTG Nursing Association, who is part of the demanding party, emphasized the seriousness in their demands. He argued that the Ministry of Health has not been taking matters of this nature seriously.
We respect our patients. Patient care is our priority. So we've been advocating for that, and we will still advocate for that. but this has been a long overdue. So these are basic things that needs to be solved. We've seen recently doctors and then PhD holders, there has been increment in their allowances. So and then our own was tabled earlier before theirs. So then almost 3 to 4 months back, we've tabled these things. So they do not even listen to those pledges, and then they went on to increase those ones. So that means there is selective when it comes to the healthcare sector. They've been selective.
The healthcare system of the Gambia is faced with so many challenges, ranging from infrastructural development, technological advancement, healthcare equipment, as well as financial challenges. These challenges are time to time blamed on the prevalence of corruption and lack of foresight from the leadership of the ministry. One thing is certain, the sector continued underdeveloped as a share in the toll of disaster from the preventable complications such as maternal mortality. The Gambia has, since the change in government in 2017, a lot of threats from civil servants, mostly due to poor working conditions aggravated by low salary scales and allowances. The healthcare givers have been on the limelight several times, but not to the extent of a deadly result from withdrawal of their labor. This time, however, it is a matter of time to tell whether all health facilities will be abandoned to the patients alone. For Africa TV News, I am Binta Fati.
University students there showing solidarity with the Gambian Nurses Association who are demanding that the Gambian government look into their welfare. Now finally, technology startups and engineers in Tunisia are set to unveil a constellation of satellites in the African continent for the next 3 years. The landmark technology breakthrough has been embraced by the North African state, who vows to support the initiative. The project is made by only Tunisian graduates from public engineering universities. Here is more details of that.
Challenge 1 will have a transmission capacity of 250 kilobytes per second. It marks the beginning of a future constellation of more than 30 unit satellites that Telnet plans to launch within 3 years in partnership with other African and Arab countries.
Our next goal is to launch a future constellation of satellites for the African continent to offer Internet of Things services. This is the future of technology. We want Tunisia and Africa to keep up with changing technology. Our engineers can make this dream come true.
Tunisian Foreign Minister noted that the state will support its technology startups and engineers.
We're proud of this historic achievement for Tunisia. Satellite was developed here at Telnet and on our soil by local engineers. Many countries around the world have offered their congratulations to the Tunisian government. Tunisia is a country of innovation and creativity.
Anis Youssef is one of the most talented engineers in Tunisia. As head of innovation activities and new products at Telnet Group, he has supervised the design, development, implementation and launch of Challenge 1. Many women have contributed to the success of the first Tunisian satellite mission. Among them is Serine Waneni, who is a development, test and validation engineer.
This project was made by 100% Tunisian competencies, where all Tunisian engineers who graduated from public engineering universities were proud of this achievement.
Telnet Group says Challenge 1 is designed to transmit data from connected objects. The satellite is equipped with thermometers or pollution sensors, location chips and humidity sensors. The data from these devices will be accessible in real time, even in an area without internet coverage. Its mission will last from 5 to 7 years. According to Telnet Group, the design, development and successful launch of Challenge 1 has lasted more than 3 years of research by young local engineers. The tech company invested $1.2 million in the satellite project.
And from that inspiring report from Tunisia, we finally bring this news edition to an end. But for more details on this and other studies, as always, you can visit on our website on iafrica.tv. But for now, though, many thanks for the privilege of your company. Thanks for watching. Stay safe and have a very pleasant afternoon. Bye-bye.